First of all, to obviously state that I'm a member for the Department for Health and Social Care and political member. I have been ever since I was elected, basically ever since the departmental political teams were formed. So there's a lot of background there that I have that other people might not have access to. We've seen, as you've alluded to, we've seen Manx Care recently effectively saying that they're going to reduce elective surgery. And there's been a lot of narrative around how they have to balance the books. There's also been a lot of narrative from government that they are over budget, and it is our position that they are underfunded and that they have been for many years rather than over budget. And actually that is a position that's backed by the Sir Jonathan Michael report and the calculations that he gave for the funding formula that were approved by Tim Mould in 2019, along with the rest of Sir Jonathan Michael's recommendations, which included significant transformation and improvement work that Manx Care were tasked with delivering for the Manx public. But they weren't given the funding formula from when they were formed. So therefore, that's resulted in them being underfunded to the tune of millions, actually. And that is a narrative that does need to be more discussed and more widely known, actually.
Something the taxpayer will immediately think when they hear additional funding for Manx Care is, well, how much is that going to cost me extra? But you're talking about tax reform as well. How would that work in real terms?
Manx Labour Party has always obviously stood for progressive taxation, which is a system in which the people with the broadest financial shoulders, the wealthiest people essentially, pay more than the poorest in our society. But there are also a lot of other ways that Treasury could look to raising additional revenue that they don't ever seem to look at. Capital gains inheritance, raising the tax cap. There just does seem to be this very, very fixed mindset that the only way that we can raise revenue is by taxing workers. And that's created quite an imbalance on our island. And I think in the last budget, when the Treasury did add an additional 2% onto the highest tax band and didn't change thresholds, that has created quite an unfair situation, quite an unequal situation, essentially, for Manx workers. So we absolutely would not want to see Manx workers taxed anymore. I really do think we're at the limit there, and it would not be fair at all. It would not be equitable to put any more of the financial burden upon workers. But there are several ways that can be explored by Treasury, as I've already mentioned. And I really do think that this is the time that we need to start looking at additional sources of revenue. I mean, it's a difficult decision for people to make. And, it could be, in my view, something that needs to go out to the Manx public. Do we want to retain a free at the point of use model? Or do we want to actually start paying for our surgery when we go in for it? And that, that's very fundamental to our core values as Manx Labour Party. We believe that everybody should have access to health services. And in order to get that model working, we need to have the revenue behind it.
And what are your concerns? What are the party's concerns then? If those things such as tax thresholds aren't looked at, and we continue down a route of service cuts, as you've seen, what's the worst case scenario?
Well, I mean, I think Manx Care have been quite clear in their board meetings that this will impact patient outcomes. They've chosen the reduction in elective surgery option as their first one because that's got minimal impact actually on patient outcomes, and they will always look to what is the best clinical solution here, what is the best solution that we can come up with to meet patients' needs. But ultimately, if they are pushed more and more down the avenue of you have to stay within your funding envelope, there will not be any more money, then that will impact patient outcomes. If we're not doing a lot of the preventative work, then the acute work becomes bigger and bigger and it costs more. So it's actually very short-sighted to underfund health services, because actually it's in everybody's interest to keep our population healthy rather than to work in that area of acute care where you are actually firefighting instead of fire preventing. And I think that's, that really is quite a core value. That should be a core value of our National Health Service, and I think it is a core value of the board members. As far as I can see, having, listened to the minutes, there is not a single member there who wants to cut services. They know the best thing for patients, but if they are being pushed into a situation where they can't afford to run those services and they won't have access to any further funding, that I don't see any other choice that they can make unless the Council of Ministers choose to start charging for services, which will fundamentally change our health service.
There are some on the island, of course, who will say, well, we spend so much money elsewhere in terms of things like climate change. Could we reallocate some funds and help health that way?
I mean, I'm not a member for Treasury, so I couldn't 100% answer that question. You did mention climate change, though. There's not very much being spent on that. And actually, if we don't meet our climate targets, it's going to be quite detrimental for the island in terms of businesses who all have their own pathway to net zero. And that's part of their social responsibility ethos and framework. And if we don't have our own path to net zero, we will lose a lot of businesses. So actually, economically, it doesn't make sense to reallocate climate change funds. There potentially is, but I think that budgets are tight everywhere, and I just think that we need to discuss this as a community, that we need to have more open and frank conversations about where we are financially and what we want our public services to look like.